Welcome, everybody, to the Mental Health Hour, and welcome to episode 109 on chronic pain. That is, believe it or not, this has been on the list of to do episodes since actually it's been on the list for a while.
Yeah.
Um, it I, it gets overlooked for some of the more uh, what do you call them? The episodes that we get multiple requests on. It kind of got pushed down the list. But it has been on the list for a while. And what better time than to do it when I can't even sit in a chair
Mm.
for the broadcast? Um, let's start off with saying the obvious. It is Thursday. I screwed up. That was my fault. When I made the promo ad, I'm so used to doing it on Wednesdays. I should have given you a heads up that we had to do Thursday this week, as yesterday was my wife's 40th birthday. So we went out and had some dinner and had a nice evening. And that was that. So the plan
Okay.
um, was to not stream this week, but uh, with just taking 2 weeks off with my leg, and I think Gemma's off not next week, but the week after. We're not going to
Yeah.
have a stream. We just we were both able to do it tonight, so here we are. So thank you guys for joining us on a Thursday night. And Gemma, how are you this Thursday?
Oh God. It's been a crazy week. Um, yeah, I've been nursing two hamsters who I thought both of them within a few days of each other were going to die, but as you can probably hear, they're doing well. Um,
They were gonna die?
yeah, one of them, the white one just collapsed. It was weird. It looked like she'd had a stroke because she couldn't move her right side or something, but she's fine now. I don't know what it was. Just meant that I stayed up with her all night, syringe feeding her for a while, and she's fine
A
now.
hamster.
Yeah.
Yeah, I probably would have thrown the thing out in the woods.
Oh my. Oh, they're
Uh,
animals. I'm soft when it comes to animals,
I'm
but I could
kidding.
never be a
I'm
cat.
kidding. I'm
I
kidding.
know. Although it is thanking me considerably. It's literally suspended upside down from the cage. So any minute now you'll hear a big thud because she keeps climbing upside down. There you go.
uh,
Oh, honest.
so no, this is just a one-time thing, Mr. Opera. One-time thing only. We will be back to Wednesdays next week. So let's get into this evening's broadcast
Mhm.
because uh, we do have to end on time, being that it is not the normal night for the broadcast. I'd like to get out of here. I have to get ready for work tomorrow, and the kids are home tonight, so we're doing more birthday festivities with them, as they were with the big kids were with their dad last night.
Mm.
Um, so it was just me, the wife, and Penelope to celebrate on the birthday. So now we're celebrating with everybody. We have cake and ice cream and whatnot. With uh, they're having dinner right now. Um, so chronic pain. We'll start with what's going on with me. Move to Gemma for a little bit, and then we'll look at some slides. As you all are aware by now, I am having some pretty serious pain. Um, this
Mhm.
chair sucks that I'm sitting in right now. It's not my normal computer chair. I'm upstairs tonight, being that everybody's home. Um, so I'm on a like a kind of a dining room chair kind of deal that I have upstairs. It's an older
Oh,
chair
that'll be
from
fun to sit on for an hour.
yeah.
Oh dear.
When I was setting up the broadcast studio, it wasn't bothering me at all. But I guess I've been sitting here long enough that it's getting pissed. But anyway,
Yeah.
I have some. it's going to be confirmed this coming week. Tuesday, I go for an MRI finally, and then Thursday, I go to the spine doctor next Thursday to see what the hell is going on. It's thought to be a herniated disc on top of the sciatic
Mm.
nerve on my right side. So my pain level is at like a 9 out of 10 most of the time. I'm just today has been a kind of bad day. I'm just not comfortable.
How do you
Um,
even manage to work with it?
so I mean, when I'm up moving around, things are fine. It's like right now, sitting uh, is what's hard.
Mm,
Driving sucks for extended periods of time. Sitting, laying down. I wake up in the morning stiffer than the Tin Man. I gotta get up and grease the wheels and get my body moving um, to allow for that pain to subside. Um,
mm.
so work days are my better days. I'm up moving around a lot at work. Lifting's not usually an issue um, unless we're talking about lifting some massive amount of weight. But lifting normal everyday stuff is not an issue.
Yeah.
It is literally just sitting at idle is when it flares up. Like
I
right
will
now,
say the medical's going a lot quicker over there for you, that's for sure.
yeah, right now, my this is not good. I'm very
Mm,
uncomfortable at the moment. Um, but we push forward. Uh, we'll get into some more of it next week when I know more. Um, as of right now, that diagnosis that I have is just a guess on the physical therapist part. I've done some physical therapy for it, and
mm,
well, I've gone to my personal doctor, my regular care physician. Um, my pain right now, Jay, is about an 8, and that's not lying to you because I ride an ambulance for a living, and I have a very big respect for pain scale because every person I run that's in any amount of pain always says it's an 11. So I tend to think the pain scale's bullshit because of that. Everybody just says 10, and they've just stubbed their toe. I mean, come on. Um, so, but yeah, for real, 8 out of 10 probably right now for me. Just sitting here. Now, if
mm,
I get up and start moving around, I'll be fine. That goes down to like a 2, sometimes a 0. Um, but sitting
mm.
here, which is why I took those 2 weeks off prior. Um, so, Gemma, you also struggle with some chronic pain, yes?
Oh, yeah. It's been mine's been from birth. As I've said, I was born with both hips out of socket, um, and scoliosis. I have a fused spinal disc at the bottom because I slipped a disc many, many years ago and didn't realise because I get that much pain anyway. I've got quite a strong pain threshold because my joints dislocate that often. I just put them back myself. I thought I'd done it then.
Mm,
Um, but yeah, it's exhausting having pain all the time. I have
mhm,
my main condition's called Ehlers-Danlos syndrome. Um, and it causes a lot of muscle wasting, very, very tight muscles all the time. Ligaments, I've had surgery to loosen some of them up, but they just instantly sort of tighten back up again. But it's definitely quicker, it seems, over there for medical things happening because I've been waiting nearly 5 years now for some sort of surgery. And I'm still waiting. I mean, I had my initial appointment the other week, but God knows when they're gonna do it. But when you've got pain and you're having a for fight to get seen, fight for your medication getting right, it's just a constant battle, and you just haven't got the energy. I've had, an advocacy service helping me now for the past year, trying to get things done, because I just haven't got the energy to do it anymore. It's just a constant battle.
That's where I hit that very same point not too long ago. I was just like, "I
Mm,
can't put this mask on anymore, it hurts too bad. I
mhm,
need to get seen," and, and that's where I started with physical therapy and whatnot, um,
yeah,
so but it does a lot to as Gemma was just starting to get into, it does a lot to one's mental health, um,
mm,
which is important, uh, to keep your eye on and, keep your head to the ground on because it can very quickly get away from you. People, have gone as far as to end their own life over chronic pain. Um, the
mm,
pain is so severe that they would much rather just not live than to live any longer with that pain.
yeah.
Um, and that is
Everything that you do, it's like everything that you do seems to take a lot longer, a lot more effort than maybe somebody that doesn't suffer with chronic pain. Um, like just simple things, I guess, like making a meal or doing the laundry and things, everything just
mhm,
takes so much more effort. And I think it's not until, like, if you don't have pain all the time and then suddenly you are inflicted with something like yourself, I guess, you'd not had, I mean, you've had the problem before, haven't you? But you were doing all right till this flared up again. And it's not
yes,
until it really hits you that you realize just how much, say, if it was an arm or a leg, how much you would use that, or how much it restricts what you can do. Because if
it
you
really
go from
does.
able-bodied to having something, it's terrible. It slows you down immensely, and you don't realize how how detrimental it can be on your mental health as well. I bet your mental health's been terrible with the, pain, well, worse with having that pain because
It
I
is very bad. Well, my mental health. So I try and stay positive. As you can see, like I'm in a considerable amount of pain just sitting here. Matter of fact, I might just go off camera and stand up. Um, there's no point in having my camera on while I'm standing up. Um, but uh, I try and stay pretty positive with it because I can't see any better way to get through it. Um,
mm,
you know, it sucks. It's a pain in the ass. It's not fun. But at the same time, we're um, how do you put the what I guess what I'm trying to say is what would moping around or I, I don't want to put it so delicate or harshly. I've never been the type of guy that gets knocked down too low from things like this and let it try and get the better of me. I guess is what I'm trying to say.
yeah.
Does that make sense?
Yeah, like feeling sorry for yourself, I guess.
Right.
Like, yeah, it can be hard as well not to get like that, like, you're thinking, "I've been there myself, why me? Why what have I done to deserve all this?"
Yeah. And it
It does
really
suck.
doesn't it really doesn't help
No.
the overall back on here.
I think the thing is as well, when you're in pain and then your mental health gets worse with that, it can also make your pain worse because even though the number of times I've absolutely gone mad at my doctor or something when I go about my pain and they go on about how's your mental health, implying that it might be because of my mental health, and it's not at all. they are connected though,
Yeah, and
and
we'll take a look at that, more deeply on the
mhm,
slides.
they
Oh,
are very much connected though.
I need to send you those slides, so you can see them more better
Yeah.
as they some of the software on my upstairs broadcast studio isn't as current, uh, as it is downstairs on my good computer. So some of the slides may be a bit difficult to see tonight, but as
Mhm,
always, they will be in the Discord. As a matter of fact, I'll put them in the Discord as soon as we wrap up. I'll get downstairs on the good computer and put everything on the Discord so they're easier to see.
mhm.
If you want to see more information off of a specific slide that we go over tonight, and Gemma just sent those over to you so you can actually read them. And while Gemma is reading, I'll probably go off cam again and stand up because that does feel better. It's just such a timely episode for this. That
Yeah.
you're always you like from birth. You said have the chronic pain going on, but this is something
Mhm,
relatively new to me. Now I've been dealing with this back pain since I'd say probably end of June, but it hasn't been. Uh, I don't want to say every day has been this severe. Like
mhm.
today was a relatively good day uh, for the most part until I started sitting down to do this broadcast. This chair is just not agreeing with me in my current configuration. Um,
Yeah.
it's just an uncomfortable piece of shit chair, and so I have to stand up a little bit. But while Gemma reads, I'll stand up and we'll look at a slide or two. There's plenty to talk about here. So let's start with just something nice and easy. We'll start with the pain cycle.
Will your camera position up so you can stand if you find that easier? I wonder.
My camera? Oh no, it's okay.
Yeah. No, okay. Just a thought. And as you're saying about the pain real quick, I think it could be worse sometimes if you're not used to having that level of pain because you're used to being able to do more than maybe somebody that's had it for a long time or from birth or whatever.
Right.
Whereas I say accepted it. I have accepted it. Doesn't mean I like it. Doesn't mean that you know, you you accept that that is you. Whereas if you are perfectly able-bodied or more able-bodied and then you're inflicted with something, it can be a bit of a hard pill to swallow sometimes.
Absolutely. I'm learning
Anyway.
quickly. I'm learning quickly that, and I don't want to take away from the fact that it does affect my mental health, but I
Mhm.
do try and stay positive because I do know there's a light at the end of the tunnel, or at least I'm telling myself there is,
Oh, you have
especially
to do.
especially with the MRI scheduled and the spine doctor
Mhm.
scheduled. Um, at least there'll be some answers, and we can see a clear path of treatment. Right now, we're just kind of shooting in the dark with
Yeah.
physical therapy. They don't know exactly what stretches and stuff to treat. That was their words, the physical therapy office. That their words were, "We're kind of shooting in the dark here. We have a general idea of what's going on with you, but until we can see something on a picture, we can't really target it and combat it." You know.
Yeah.
All right, let's take a look at
Mhm.
the chronic pain cycle.
Okay, so chronic pain cycle. So at the top, and we'll go clockwise. So pain, and then anxiety. That pain is signaling tissue damage and harm. Brain becomes more focused on the problem. Changes take place in the nervous system. More pain, more anxiety, and less movement, and more changes to the nervous system.
So your nervous system is constantly changing.
Mhm.
Uh, the anxiety is up, especially when you don't know what's going on exactly. Um, and
Yeah, yeah.
when your anxiety levels raise, then of course you get sicker, right? You talk
Yeah.
yourself in, your brain starts overthinking, your brain starts working against you, and
Mhm.
now you're in more pain, right? Um,
Yeah, and the worst thing you can do is Google it. Please take my advice on that one. Don't ever Google it because you can end up yeah, it's rare that you can get any good out of doing that. You are absolutely always best going and seeing a professional. It's alright for
Absolute.
little things, but yeah, it's mm, I've
Um,
done it myself.
wanted to do this one next here. The mental health aspect of things.
Yeah. So we have in the middle chronic pain, stress, illness, diet, anxiety, and a holistic approach to mental health. We evaluate diet, exercise, stress level, and it says all relative to your level of happiness. So, Eastern medicine views the body and mind as one. Many chronic pain patients suffer from anxiety and depression as a result of chronic pain, but there is hope. 30 to 54% of pain patients with comorbid depression, biofeedback treatment, so stress, coping, pain response recognition, pain control, and stop future pain episodes. Then we got health and the complete state of physical, mental, and social well being. Um, chronic pain's vicious cycle on mental and social health. So I'm just going to zoom into that a little bit. So it was like similar to what we had on the previous slide with chronic pain in the middle, anxiety, sleeping problems, not coping, increased pain. And then there's things like general health worries, worries about employment, work cover worries, doctors and hospital visits, and then there's the anxiety, anger and frustration with that. Financial worries, perhaps if you're not working because of it, or the extra costs because of things to do with the chronic pain. Family and relationship worries and sexual concerns. And then on the other side, so spinal cord sensitivity tracts, it starts in the brain, regulate spinal cord sensitivity, determine pain perception, and connect the nerves. So that's got quite a lot of information on that one. You might want to have a look at that in the
Yeah,
Discord when it's posted.
yeah. Like I said, I will. I'll put this up immediately when I go downstairs. Um, I don't want to do it up here because I was talking with Gemma in the studio before we went live. This computer's so outdated at this point, and it's a 2013, which kind of blows your mind. Uh, it's only 10 years old. Um, it's iMac, just like my new one downstairs, but I got the new iMac that came out a few years ago, 1 or 2 years
Yeah.
ago.
Oh, I had
Um,
the old iMac. It was on Snow Leopard, I think.
this is yeah,
And they stop upgrading them after a while, don't they? So then it just
yeah,
becomes completely
it's
unusable.
this one's stuck on Catalina, I think, which was 2016, 17, something like that. But
Yeah.
it was such a pain to try and set up this broadcast studio because nothing wants to download. Anywho, that's just a tangent, but a lot of good information here. So please do go and take a look at this one in the Discord. I'll also link that for you in for the folks that are listening to this on the replay on the YouTube or listening on the podcast networks.
I've just put
Um,
it on the screen for YouTube. There we go.
yes, there we go. 'Cause as we are broadcasting on our unusual night, there's not a whole lot of folks here for the live, which is fine. Um, we didn't really advertise that we were doing tonight, but uh, lots of good information on this slide in
Mhm.
particular. There's so much that goes into your mental health, everything from sexual libido. It's very hard to have sex when you're in constant pain, and
Oh,
that's
yeah.
just important for your mental health as anything else. Gemma was talking about finances there. Uh, this MRI will cost $5,000. It's a $5,000 picture
Oh my
of
good god.
um, that's what insurance is for. But unfortunately, to get it approved by insurance, you have to jump through some hoops and be in some pain for a while, i.e., the physical therapy I've been doing for the past month that hasn't done anything for it. Um,
Mm,
but now that it's been approved, all that good stuff, there'll be a copay and what have you. But it's just the mind reels it. Some X-rays and stuff for like 80 bucks, a couple $100. An MRI, which is a giant magnet where the X-rays just show the bones and everything. It's not going to show the nerves and everything in the muscles,
mm,
which is what you want to see. You need the MRI to see the nerves, which is what I'm having is nerve pain, which just cannot even be combated with most of your prescription medication, like Jay was asking about earlier.
mhm,
But anyway, that's just a small look at the financial side of things because if there is no insurance present, or you have to pay out of pocket for whatever reason, like the insurance just isn't gonna cover it because you're not jumping through the hoops or doing whatever they ask, or maybe you're out of network or whatever the case may be. That's 5 grand out of pocket to get the
mm,
diagnosis that you need.
blimey.
Um,
One thing that
so
might help, like, just thinking out loud here, I used to get a lot of, I've had sciatica, a lot of nerve pain in my lower back, and when I had the sacral nerve stimulator implant, I know it
mhm,
wasn't for that, but that does seem to have had an effect on my lower back pain.
uh,
It's effectively like a TENS machine, but on the inside, and it's attached to your nerves.
yes, so I do have a TENS machine, and that does help. As a matter of fact, I should probably put it on right now, but
Yeah.
I'll probably put it on when we're done the show. Go downstairs and
Mhm.
throw it on. Um, but all of those things play a major role. Everything from finances all the way down the list of just your regular everyday feel goods, for lack of a
Mm.
better term. Your regular attitude um, is affected tremendously. Um,
Yeah.
and now I haven't seen Craig, our friend, that bloke Craig, tonight, but I did find something. Hold on, not this one. This one, Pain Australia, for our Aussie friends. If, if you want to take a look at this one.
Yeah, okay, so chronic pain and mental health. So the impact on personal life is greatest in young adults, with 4 in 5 people with chronic pain aged 20 to 24 reporting interference in daily life. Up to two-thirds of people with arthritis say their condition has affected them emotionally. Almost 1 in 3 Australian adults with severe or very severe pain have high or very high levels of psychological distress. And then 4 times the rates of depression are 4 times higher among people with chronic pain than people without pain. And then research indicates there are strong links between anxiety, depression, and chronic physical illness. And again, it's just got the circle of
Right.
anxiety, depression, chronic physical illness, because
Right.
they are all very much connected.
Absolutely. And that is all those stats are from our friends over in Australia. I saw that slide and I thought I'd pop it on there for our friend Craig. Uh,
Mm,
hopefully he catches on the replay. Let's move forward to what chronic pain does.
okay. What chronic pain does? Untreated chronic pain, a diagnosis including arthritis, back pain, and recurring migraines, can have a profound effect on a person's day-to-day life. So, pain wears a person down, draining their energy and sapping their motivation. Attempt to limit social contact in an effort to reduce stress, and then decrease the amount of energy you have to spend reacting to your environment. And that was under depression. And there's brain chemistry. So, chronic pain can actually affect a person's brain chemistry and even change the wiring of the nervous system. Cells in the spinal cord and brain of a person with chronic pain, exacerbating many of the depression like symptoms. And then, roughly one third of patients with chronic pain develop depression at some point during their lifetime. And then, treatment using various chiropractic adjustments may aid in boosting the nervous system and immune system, in sending messages to the brain, and aiding in the positive change in a person's main and depression symptoms.
So chiropractors, I've heard a lot of good things about. I have not been referred to one yet. Um,
Mm,
I don't know that I will, because I'm able to get that MRI now without going. But that's something else to throw into consideration because not all chronic pain is the same, right? What works for Gemma might not work for me.
mhm,
Um, we're also discussing a multitude of different things. My sciatic nerve pain is not the only thing that is considered chronic pain. As you
mhm,
can see here, it's also discussing migraines that are that you get frequently,
yeah,
frequent migraines, and
migraines.
arthritis is another, um, rheumatoid arthritis, all the way down to just minor arthritis in your fingers and what have you from old age.
Mhm,
Um, carpal tunnel syndrome. Uh, all of these things are considered chronic pain and that you deal with. Um, some people, their entire body aches, the joints, everything.
yeah,
I just
fibromyalgia, things like that.
fibromyalgia. Thank you. I couldn't think of the condition. Um, so there's a number of different things to consider here, and what this is doing to a person is just wearing them down, as
Mhm,
this slide illustrates. You're looking at your day to day just being muddled through instead of enjoying what used to be. Uh, I used to love doing this show every week, and now I
mm,
can't wait to get the hell off tonight because I am so uncomfortable. Um, but, but that's just this week.
yeah,
The past 2 weeks that we've done, I've been fine in my chair downstairs. Things have been pretty good. Um, I think it's
yeah.
just the chair tonight. It's like sitting on uh, uh, pins
Oh,
and
for
needles.
real. Like, anybody with any sort of back pain, I'm terrible on certain things. It's just, it makes it so much worse, especially if you're really uncomfortable.
Yeah,
I'm assuming you'll have heard the spoon reference to chronic pain.
the spoon reference.
Yeah, like when they say about how many spoons you've got, it's something to do when a lot of people with chronic pain, and it's like how many spoons you've got and spreading them out over the day. Don't put all your spoons into one cup. Spread them out so that you are able to go on longer. And
Break the day down into
yeah, yeah,
segments. Such,
they
yeah.
refer to it as spoonies, and um, like sharing them out and things. Don't go like putting them all your spoons into one cup and then you've got nothing left. I'm terrible for doing that when I have a burst of energy. I tend to go all hell for leather and do what I can and then end up suffering for a few days afterwards. and he can be really hard because so many times there's so much I wanna do, and I'm just so tired with it all,
Yeah,
and, like, my head and my heart wants to do something, but my body's just like, "Nope, not today."
not today.
And yeah, it's
Yeah, I've noticed that thing. Well, I think I mentioned it already. Is that some days are worse than others. Not all days are bad.
yeah.
Um,
It's when we spoke about grieving, and I said then that when you have chronic pain, especially if it's long term, you have to grieve for what you once were and come to terms with the new you, if that
yeah,
makes sense, because
it does.
you have to modify and change your life to fit around your capabilities now. And when we were talking about expense and things, one of the biggest expenses I have had, initially, I mean, it's more of a longer term investment for things like that, is finding aids and adaptations that will make my life that bit easier. Like, I have
Mhm.
every kitchen gadget you can imagine that is for, like, people with arthritis and disabilities and things. There's some really good ones out there. I might put some in the Discord because they are quite helpful. But there is certainly a lot of things you can get now that will help with that, both with the pain and with helping you to make sure that you can manage
Yeah,
with your life, with everything. And it certainly does help because the worst thing about having chronic pain is the feeling of losing your independence and
yeah.
having to be completely and utterly reliant on somebody else.
To come to the
Mm.
to
And
the
that was
pain,
my biggest fear, not being able to do things for myself
right?
because I didn't want to be cared for. I didn't want to have like a relationship or anything where somebody was having to care for me. I want to do these things myself. It might take me
Yeah,
longer, but it's getting the satisfaction out of still keeping going. Like many years ago, I was offered a wheelchair and said that I'd be in it because it's just like things are getting bad, but I refuse. I'm like, no. I mean, I'm not saying that everybody should. Like, if you need it, you need it. But
right. But
I
it's been
didn't want to give in at that
right.
time. I'm not saying
I
that
understand
at some
completely
point.
because
Yeah.
here I sit and I said, and we've only got 3 people here for the live tonight. As of right now, all I see is 3 viewers, which is it's fine. We
Mhm.
we do a lot of numbers on the replays. We're here to record it tonight. But here I sit on cam. I could be off camera standing right now, but I'm so stubborn that I want to be on camera when at least you're not reading the slide. I'm just gonna sit through this pain instead of succumb to uh, the comfort of standing, I guess, because I want to be on camera.
Yeah.
Um, but it's so silly because uh, I don't. It's not silly, and it goes along with what you were saying. It's not that you feel like you'd be lesser or whatever for having a wheelchair, but
Yeah.
you're not ready to give up
Mm.
hope that you don't need to give in.
Yeah, yeah. Like, it hurts me and I'm a lot slower, but I can cope with that. I can still do it. I might not be able to do as much, but I am
And
aware that I've achieved what I've achieved and
And I,
it's
I see how I
it's
see
good.
what you were saying about now after saying that, uh, it's not giving in. Y-
Mhm.
you know, those of you that are in a wheelchair, you've not given in. We
Oh, no,
don't
not
mean
at
like
all,
that at
no.
all. But like part of having this chronic pain, from what I've learned, from my little bit of a stint with it here, is that you need to fight a little bit to
Mhm.
tell this son of a bitch it's not going to win. and that I'm still gonna be happy. I'm still gonna do my thing, and I'm still gonna do my show, and I'm
Mhm.
still gonna sit here on camera, and, it's you're not gonna beat me. Um,
Oh, yeah.
you have to have that fight, and once you give up that fight, that's what I think you're getting at. You
Yeah, yeah.
start to feel like you're losing
I
the
wasn't
battle.
ready to just say, like, I everybody's different, and yeah, if you need a wheelchair or if you need something for you to make your life easier, absolutely you should do it. But at the time that I was given that option, I'd spent some time in a wheelchair anyway because I'd had surgery on my legs and I couldn't actually walk. My arms were not strong enough to support me in that sense with both legs strapped up and things. And it wasn't until I was in that wheelchair that I realized how difficult it is, and I absolutely empathize with anybody in a wheelchair because unfortunately, even though the world is more accessible than it was, we've still got a long way to go. I don't feel like
Right.
there's still a lot to achieve with that, and I didn't
There and
realize
there al and,
how difficult it was.
there's almost always gonna be room for improvement, and that's part
Yeah,
of
yeah,
growing, especially as a society, and understanding each other better. Um, there is 2 more slides that I wanna look at real quick,
yeah.
before we wrap things up for this evening.
Mm,
Um, let's see here. Let's start with this one is gonna be a bit tough to see on the live or on the YouTube, but, once again, it'll be in the Discord. I'm gonna have Gemma read this one off because 'cause it's got a lot of good information.
yeah. Okay, so what works for pain? So on a cure, there is surgery, time, weight loss, and disease treatment. So it says ideal for when the underlying cause of pain is threatening to overall health and treats the underlying cause of pain and not just a symptom. Can sometimes permanently eliminate the pain, but the negative so it's like, yeah, the positives and the negatives. So the
Right,
other 2 positives. These negatives are expensive and invasive. And then supplements, ideal for chronic pain and inflammatory conditions. So oral, such as magnesium, turmeric, devil's claw root, not heard of that. Butterbur, boswellia, omega-3, excuse me if I'm saying them wrong, fatty acid, topical, so capsi capsicum? I
capsaicin,
got it. Um,
capsaicin.
and yeah, analgesic cream, camphor, menthol, and comfrey. There's
So,
many, that's just a few. I
that's
can't
a yeah, that these are all, supplements and such that are suggested for chronic pain, uh,
mhm,
mainly because those, painkillers and, prescription level drugs don't touch nerve pain.
no,
Nerve pain is in a class of its own, and it just laughs at Vicodin or Percocet or anything like that. So you have to go sometimes the supplemental route. And then that menthol stuff is also like topical creams and Bengay. You probably would recognize, or Icy Hot. These are the mentholated type
oh,
rubs. And
yeah, DP we have,
yeah,
or deep freeze. Yeah, yeah. So the positives of those says very few side effects, and the negatives often require long-term use, maybe condition specific. Research often I can't read that. It's blurry. Research often I can't
I'm
read
sorry.
that word. It's blur. Need to check for interactions, but you need to check for interactions with anything that you take.
Sure. Especially
Um,
with especially with like the icy hots and the stuff that you're rubbing on. like lotions. There can be allergies also with the supplements.
Yeah.
Like I just said, with anything, there could be the risk of allergies. So always consult a physician.
Yeah, yeah, definitely. So physical treatments, this is ideal for acute pain, healing from an injury or surgery, and many chronic pain conditions. And we have examples of vibracool and duotherm, massage, ice, heat, acupuncture, yoga, foam rollers, mechanical tape, TENS unit, swimming, positioning pillows, ultrasound, hot showers, compression, alpha waves, stretching, trigger point devices, baths, weighted blankets, and orthotics. And the positives, variety of options to fit lifestyle and budget, non invasive and non addictive, and can be combined for greater results. And the negatives, varying levels of proven effectiveness between different treatments, and may take time and experimentation to find the right fit. And then there is mind and body solutions that says ideal for chronic and acute pain in combination with physical treatments. And these are, for example, meditation, emotional support, puzzles, hugs, support group, personal faith practices, music, cooking, dance, videos, hiking, games, museums, sitting and accomplishing an activity,
All
goals,
kinds of self care.
all sorts, yeah, deep tissue massage, deep breathing, loads of different things. Aromatherapy, there's a lot of people that I've spoke to that uses those. The positives of those is sustainable treatment for chronic pain, it fosters support systems, nearly infinite variety of distractions, and more effective than traditional pain therapy for some types of chronic pain. And the negative is requires difficult mental shift in thinking about pain.
Yeah. So what we're looking at here is some ideal options for uh, cures, or not necessarily always cures, but sometimes just betterment or bettering situation. You might take it from
Distractions and things. Yeah.
I take your pain level from an 8 to a 2, which is a win
Mhm.
in my book. Um, you're not always going to get back to a 0,
Mhm.
uh, especially with some of like meditation and whatnot. That said, you should do that in conjunction with some of the physical treatments like um, massages and
Mhm.
stretching, etc. Do some of the self care stuff to help improve your mental health, which will then take away from that anxiety and take you out of that chronic pain cycle that we've seen a
Yeah.
few times. Um,
It might not
the
come
other,
easy at start as well, like, you have to just keep trying. Because I know if you're in a lot of pain and you're trying to do relaxation and meditation, it can be hard to not be focusing on the pain. So,
mm,
just keep persevering with it.
and there are also some good options to get away from painkillers
Mhm.
because, like my pain is nerve pain, so that's not going to be helped by painkillers. But most chronic pain can be treated with painkillers, and those are very addictive, and they can ruin your life just as easily as the
Oh,
pain
good.
itself. Um,
Yeah.
that
You
being
end up
said,
taking medication side effects of medications, and that's just
yeah,
mm,
let's take a look at
so
this last slide, and then we'll. This is just some more
yeah.
treatment ideas and options.
Okay, so treatment of chronic pain. So number 1, over-the-counter pain relievers. Taking over-the-counter pain relievers such as oh, we don't have a I what's that word?
Which one?
ACE
Eh,
to
not or non-steroidal anti-inflammatory?
well, the one before
NSAIDs.
it, I've seen it, when I
Oh,
bought
acetaminophen.
prescription meds. That, yeah, we don't have that
It's just
here.
that's
That
just
not that I've
Tylenol.
seen. Okay, it's yeah,
Acetaminophen and
um,
Tylenol.
or non-steroidal anti-inflammatory drugs such as aspirin or ibuprofen can help relieve chronic pain. Number 2, opioid pain relievers. So medications that contain opioids such as morphine, codeine, hydrocodone, and can help reduce chronic pain. Opioids are addictive and should be used short term.
Yes.
They are very addictive and come with many side effects. Adjuvant analgesics. This one's full of delightful words for me. Oh my god.
Let's
I
go to the
think you should
next.
just do this. Good grief.
Number 4.
Yeah, electrical stimulation. Electrical stimulation reduces chronic pain by sending mild electrical shocks to your into your muscles, so like a TENS machine. Number 5, nerve block. Injecting oh my goodness! So, yeah, it'd be like hydrocortisone and things into the nerve roots that are sending pain signals to the brain, helps to block the pain. Oh my god, he's found a delightful slide for me this time, hasn't he? I should have
Saved it
totally
for
gone
last.
through this. If you'd have sent me it before the broadcast, then I could have looked them up. Oh, dear me. Number 6, we have nerve oh my god, nerve ab ablations?
Yep.
This is the permanent destruction of the nerves that are transmitting the pain signals to the brain. Oh, I can't even say number 7.
That's fine. I'll
Really?
probably just cut the slide out of the fucking
Yeah, there's lots. I've never even heard of half of these. I think it depends where you are in the world as to what you get offered. Because as we have discussed before, the way in which they prescribe opiates over here is extremely different to the way they are in America
Yeah.
and other countries. So, depending on where you are in the world, I think it depends on what you get offered, what you get. But make sure that even if you're offered something by a doctor, make sure it is right for you. Look into it a bit more because the medication I'm on, I wish I'd have known then what I know now about it because I don't think I'd have started it, even though I was being given it by a doctor. At the end of the day, you're the one putting that into your body.
It's
So
important with anything
look
that we
it up,
discuss here,
go into it.
it, especially with painkillers and what have you, it's paramount to be
Mhm,
in contact with your primary care physician at very minimum. Um,
mhm,
there are pain management specialists to include into the conversation as well if that's a road. If you're in chronic pain, uh, everything that was I think they're more for now, I don't wanna I'm not gonna say because 'cause I'm not sure. I'm not gonna just throw information out there and it's not true. I think pain management specialists are for, like, those folks with rheumatoid arthritis or fibromyalgia,
mhm,
not just something that you probably wouldn't go see them if you just had surgery or something, and
yeah,
you just need to take a few days worth of medicine to get over the hump. I think this is more of
mhm,
a long-term care physician. Um, but
yeah.
anyway, that should about wrap up tonight's episode. Um, let's do a quick community calendar. I do have to upload that one. Um, Gemma,
Oh, I
you had
changed rays on the intro as well, I remembered to do it.
what is it?
I changed
Oh,
Ray's, slide at the start to the
oh, the slide
YouTube.
on the intro.
Yeah, I remembered. Right, here we go. I'll put them up for you.
So let me put this up as well. There we go. That should come up. All right. Last night was Catalyst with Jim in Chicagoland. Uh, every Wednesday night, give Jim a follow. He's a good friend of ours. Um, and he will be on tonight doing Twitch Blitz, which is a football broadcast if you're into the foosball. Check out our good friend Array of Sunshine on YouTube. There's his link. Good stories, good vibes. All these stories from around the globe. He puts together some pretty decent information and broadcasts. So highly recommend him as well. Beardo and Weirdo Show is back with our good buddies Blaine and Piano Man. Thursday nights at 8 p.m. I know they went on last night for a special episode, so I don't think they'll be on tonight. But normally Thursday nights around 8 p.m. Eastern Standard Time. And my co-host Gemma, she's doing her cooking trains and regular broadcasting, crafting, baking, cooking. Also, while we're on the subject of Gemma, I'll let you go ahead and talk about the med.
Yeah, I'll be on that one apparently as well. He does a Halloween quiz, every year. I've seen the amount of work he puts into those. It's very good, very fun. And apparently I need to dress up and be on there too now. Um, oh God. So
uh,
yeah, it will be.
Saturday, the 28th of October. So
Yeah,
we'll look forward to
it's
that.
on there. Yeah,
Absolutely. We will be there, or I will,
yeah,
let's see, the 28th.
fun
I'll
time.
have to go downstairs and check and see if I'm working or not, but hopefully I am off and I will at least, very least, catch the replay if I miss it. Uh,
Yeah,
and then for all things bunny, there we go. For
yeah.
all things bunny, please check out our great sponsor, Ella the Bunny Mom. Her store is mybunnyvalentine.com. Use the promo code FireDude15 to save 15% on all your purchases. Uh, and you can catch her live on Twitch at twitch.tv/Ella the Bunny Mom. Um, and yeah, that is all we got for this week. We will
Mhm.
hop off and we'll see you guys back here next Wednesday. We'll be back. I'll be back downstairs in my comfortable chair and I'll be able to be on camera more. So, all right, guys, thank you so much. Here, and you can enjoy this old outro for those of you still here, uh, since I don't have the new one on the computer up here. Bye now.
Bye.